Xin chào, good morning, ladies and gentlemen, dear distinguished speakers and the host of the Pham University Medicine. It is my great honor and pleasure to join you in this third International Family Medicine Conference in Vietnam. And I hope I will be able to join you together in the very soon near future. My interest of sharing with you regarding the hear the patient's voice today, and I see that is the core health literacy and precision medicine. Let me introduce myself a little bit. I'm now a professor in the medical school, and I am president of the Asian Health Literacy Association, HLA, director for international affairs and attending physician in the Sichuan Memorial Hospital in Lugang, Taiwan. I'm also a distinguished advisor in the Ho Chi Minh University Siem Hospital in Dong Nai Province in Vietnam, and also the current president of Taiwan Vietnam Medical Biotech Association, TVMB. I'm also doing a service in teaching education as a adjunct professor of the Thach University School of Medicine, and the past vice president and the current chair of the Council of the past president, the International Health Literacy Association, IHLA. And I believe I met many of you in the before, and I hope soon in the future. I certainly very interested to share with you one of my recent book publication. It was my experience in last year. I stayed 6 months in Dong Nai Province, Siem Hospital, and I call it a medical mission in Vietnam in 2021. And that was in the beginning of the high rise in the pandemic COVID-19 in southern Vietnam from end of March to October. And I hope sometime in the future I can share with you some of my thought and observation. Here is the picture. I was doing teleconsultation in the hospital with patient around the area. We are talking about health communication and hearing the patient. Here is the cartoon. It says that the doctor is just wondering. He listened to all my irrelevant, boring stories. After the lady was meeting with the doctor, after that, she was sharing with the reception, and you can tell how happy she was. I mean, sometimes the patient was not really very focused, very professional. There was no professional patient. All the patient experience is non-professional. It's lay information. Sometimes they don't know. And that was the case in most of our healthcare services. So in medical practice, we have SOAP, SOAP. But before we go to real SOAP, here is how we deal with the COVID-19. In the beginning of the COVID-19, I guess you also have remembered that we use very simple SOAP, which is very popular, old hygiene technique. But even in the pandemic, when it was just starting, we have many problems to deal with this soap problem. And you can tell many parts of the world in the hospital, in the community, in television, they show how people can wash your hand, the soap. It's even a very simple material. For 110,000 years, people have using the soap. But in real life, it really having not an easy task. And as a healthcare profession, it's very usual for us to forget how simple things can complicating the patient, the layperson, and which I hope you like to keep this in mind that even the very simple things for us could be a difficult one for the patient and the families. So in the real life medical practice, we have SOAP. We use this as a very systematic way to getting information and doing our medical practice. So we wonder, how do we hear from the patient? And the patient always asks, how do the doctor, the nurses hear from us? Do they understand? Do they understand their problems? So a subjective, a complaint from very from the core of the patient or the families would be very simple and very important. So we first have to understand their subjective feeling, and then we have objective observation, assessment, and we do our planning. But for the first part, it's very essential. So when you see the patient, they talk about what's their problem. We have to analyze and put it into a systemic way to understand what's really problem. And none of the patient can tell us exactly what we like to hear. We have to ask them. We have to let them express what they are feeling. So I'm thinking that to listen to the patient, to understand the patient, is essentially important. And because usually they do not understand the problem, they do not understand the real situation. Otherwise, they will go be misguided to go somewhere else. So, chief complaint in our medical practice is the first thing we usually do. It is the description of the problem for which the patient seeks treatment. Why they come to see us? What are the chief problems? It should be recorded in patient own words and should not be recorded in medical terminology. So they have to be very lay terminology. They are feeling, they feel cold, they feel headache, they feel soreness, they feel something wrong, and very nature, very original, but it's non-professional. And here is the highlight of this taking chip complaint is that overall treatment plan resolve around the chip complaint. So if we understand the chip complaint very well, very precisely, we can resolve the problem much easier. It consists of information which promote patient to be a clinician. The form of notation should be in patient own words. Just take what they say, what they really want to tell us, instead of what we hear, what do we perceive or analyze. The symptoms are phenomenal sign if deviation from normal and indicative of the illness. So that is the chief complaint. And I believe you all familiar with all these practice in your medical career life. But even the very simple one like this is not easily achievable. And in many of the studies showing the 55% of communication is body language. It's not verbal. And I hope maybe you appreciate that kind of sensitivity. Here I show you the way of doctor-patient interaction you like. We have many patients in our daily activity, professional activities. And the number one and number two, they are different. So I don't know if you like to raise your hand. Now, which one you think you enjoy being a patient? If we are a patient, if our family members go to see a doctor, what's the interaction between doctor and patient you prefer? And I think that all these four are nicely situation, but they are different. And I would like particularly mention number four. Number four is the mother with likely the daughter, and there's a family member with together, and that's essentially important because I do believe that family members are very important in the care of the patient, and sometimes we want to engage the family member together with when we interaction with the patient. And private and close contact, like number three, is essential. Sometimes the old guy cannot tell us exactly what they want, and they have many problems. So the distance is helping the communication. If too far, they don't want to express or they are scared to express what they're really feeling, and they may not tell what all they want to tell you. So we will have to be taking care of the distance. Certainly in a COVID, we have to keep a distance. That is the difficult situation in our COVID. And so in the COVID period, I believe many of these communication are getting less effective. Here I show you how COVID has impact on the interaction we have. And you can see the patient was isolated. The doctors are also isolated in the particular gears. And also we have patient number 2 on the left hand is waiting. So the way of communication is not good, particularly you have many patients waiting. And we have to use healthcare technology. I believe it's even more difficult to have a facial expression or the way we can detect the chip complaint. Now I show you another example is which doctor-patient interaction you like if you are the patient. And I believe none of you, except number 4, will be preferable. And in this situation, patients are waiting, and there are too many patients. And this is the difficulty would jeopardize the quality of healthcare. And number 4 is particular is during the COVID, and one-to-one is certainly a nurse to a patient, and they're showing how the way can do illustration. So I'm going to show you more specifically how the communication element, because communication, including verbal communication, voice management, the voice to high or low, and actively listening. How are we telling the patient that we are listening them carefully? How can we move doctor and the patient more closer together? And there are culture awareness. How the culture in Vietnam and in many parts of the world, maybe in Australia, the way of culture awareness between doctor and the patient. And also they are including non-verbal communication, the face expression. I'm going to show you how these face expressions. So tips of effective communication, including the following. And effective partnership start with the getting to know each other and working together to leverage experience and abilities. These tips help create a comfort environment with sharing understanding and communication, which is open. It's open communication, it's honest and respectable to each other, including the following. Let me go through this with you. Share the floors. Everyone needs time to speak and be heard. So do not put them in a short, all right, what do you want to tell me? In very short distance means that they cannot really tell you. Keep focus. Avoid side conversation and stay on topic. Avoid going to the other direction and going to talking with the others and lose the concentration. Take care of yourself. Do what you need to do to stay focused and involved. Embrace the difference. We all bring different idea and opinions. So listen to different idea, opinion, or expression. Respect confidentiality. So what was told was really keeping between us. What is shared and stay private. Avoid healthcare speak. Remember, not everyone is a healthcare provider. Many of them, the patient, the families, are not professional. We have to talk in a very simple, plain language. Be present. We have to be there. Give your full attention to the work that you and others are doing. Pay attention to. Know your staff. When the environment, your colleague working with you, do your homework so you can actively contribute. So they have the teamwork with the healthcare interaction, and respect people's time. If you can make it, let them know. Well, I have a short time, only 3 minutes. Would you like to tell me more about what you really want to tell us? And the other thing, I can help you. Well, there are very classical study regarding how the communication technology can be used by respondent. I mean, this is a survey by early 2000 in the USA University. They look at the technique used with low health literacy patient, and it's a survey of physicians, nurses, and pharmacists. And I can share you the rank of order of communication technique routinely used, including using simple language, avoid technique jargon, handing out printed material, right? Show the patient some of the reading material, speaking more slowly. Don't speak too fast. That patient cannot understand, or even write down the note. Reading aloud instruction. There were things we have to read one by one. It's very important for the patient. Writing out instruction or write down something. All right, go home. You have to take this medicine, write down material, and show to the patient. Print 2 or 3 concepts at a time. Presenting 2 or 3 concepts at a time and checking our understanding. So don't tell them a lot of things. After doing this, you have to do something else and come back tomorrow. I think usually the patient get lost. Tell them 1 or 2 things and check with them. Do they understand? Asking patient how do they like to follow instruction at home. All right. So I tell you this: when you go home, how are you going to follow this? And asking them if patient would like family member to be in the discussion. So if you want to your mother or your husband to come together and I can share with you, ask your patient to repeat information, teach back technically. So after you explain to this to the patient, tell us what do you know about this. Now, do you understand more about your situation? Do you understand my analysis on the chip complaint you have now? Understand the key point in patient information handout. So give them some very important. Sometimes we give them a lot material. We give them a lot of material, but point out one or few that they have to remember now. Having patient follow up with different office staff to review instruction. So if you have limited time and your patient are very confused or a little bit confused still, you can say, okay, you can tell Miss Nguyen again. She will tell you, go through all this instruction in case you have no time to really help him and repeat this instruction. Draw pictures. Pictures are usually very, very helpful. So give them some good pictures, easy to understand. And follow up with a telephone call to check understanding. So if possible, certainly it's not easy if you have too many patients, but you can call, ask your nurse, your Miss Run, to call the patient at home 1 or 2 days later, say, how do they follow up these guidelines? And use model to explain. So we have to use some particular example to show them how do they understand. So this is very similar. I will not go through. And you can say that rank order perceived effectiveness of communication technique. So every doctors, they have different opinion of doing communication. And people use different technology. And important thing is that you have to understand what kind of technique you can convey the message more effectively to the patient and let them understand and follow this. And all these are very essentially important for patient-doctor communication. And these are some of the examples more recently studied that verbal and nonverbal method for facilitation patient-centered communication. And here are some examples of verbal one and nonverbal one. Let me go through it. There's a continuous. All right, we encourage. They say something, we say, okay, go on. I hear you. Aha, that's the point. Yes. So you encourage the patient to tell us, continue to tell us more. Legitimation. All right, after the explanation, they're wondering what they tell us is correct or not. They say, well, that makes sense. That's reasonable. Well, I understand you. Open-end question. Tell me more about that. All right, anything else? Why after that you have such a problem? We encourage them to tell us more. Understanding. Right? It seems like you have this big problem since 2-3 years ago. Exploration. I wonder if you tried that medicine before. Refreshing. Let me summarize what you have told me so far. All right. After they have a long explanation of what their problem. We can also feedback to them and check in the patient understanding. Could you summarize what we have discussed so far? About 2-3 minutes or 5 minutes. Tell me some of your understanding. There are also important things like a nonverbal attention, judicious eye contact. So look at the patient, okay, in different way to see do they really having comfortable explanation of what their problem. Responsiveness, facial expressions such as grinning, lip biting, and concern frowning. That's the important. And patient would feel you touching, you listen to them. Attentiveness, holding on chins, keep index finger on temple. That's very important. I mean, something you can tell the patient. Openness, palm exposed, avoid crossing. This is not good. This is not good. Looking at them. Interest, leaning forward instead of going back. All right, I don't want to listen anymore, but this is more close. We want to hear more about you. Active listening, head nodding. That's right. That's very important. And I think the patient will start to be encouraged and focus purposefully, turning away from the computer or medical life files. Take for the silent pause. Very good. That's very encouraging. So here is some of a summary of the diagram. Patient-centered communication-based skill, including, I will not go to all the details. Communication skills, understanding patient perspective, empathy can be expressed, name of the feeling, treatment options, right? These are also very important. And before, after diagnostic, you have to tell them something more. So these are included in the basic communication. So here I show you some example in real life. Doctor said, I like to let you know. All right, right or left side, doctor are telling with the diagram the patient about it. But do not forget, after you tell the patient, you have to look at the patient. Do they really understand? Are they focused? Are they thinking closely? Do they have more questions? On the right hand side is a telemedicine care, right? It's using different technology, and there was an assistant nearby. So you can tell this to the patient. But on the other hand, the patient, I want to ask, on the left-hand side, it's not good. There are many things is not good on the left-hand side. The doctor was busy with the computer. Now look at the patient, right? And most of the cases, even in Taiwan, I don't know about Vietnam, doctor are busy with the computer. Patient are on the other side, is the minor side instead of the major side. And also there are many, I show you many of these diagrams are distracting. And also time is not convenient. It's not friendly, right? The clock is usually not. And here is another example. The nurse is teaching and patient are waiting, but they are not pay attention to. You have widely distributed, too many distraction, and this is not very helpful. So one of the things doctors need to know is that the healthcare right, the patient right, and sometimes very easy for us to forget or neglect. Patient right including access, how easily or what technique they can access. The safety, the healthcare service practice has to be with adequate safety. In the respect, they are human beings, they are patient, they are in trouble in their health, they have something wrong. They want to ask to help them. And how can we show respect? The respect is helping the relationship. The partnership, they are our partners. They are not only just a patient, they are partner. Because without good patient, there will be no good doctors. Good doctor coming from patient, they are getting better. They understand how to take care of themselves after our instruction, helping them. And good patient showing the way of good doctors. Information sharing, privacy, and also give feedback. And this is in Australian checklist for the healthcare right. And there are many other forms. You can, I believe, you also have that. So what are the barriers for patient-doctor communications? The patient and providers. Patient feels shame, discomfort. That's the reason they come. They fear, their anxiety. They have many nights they cannot sleep. They don't know what's wrong. The heart was pumping. They feel stress. The language is sometimes not so efficient. And education. This is the example in many other countries that there was a migrant workers, Gerber international patient, and also different in education labor. The doctor usually very highly educated. The patient was not so much, so they worry. The provider time constraint. The doctor has limited time to take care of the patient. Authority figures. I have to show I'm highly respected. I have a credential. So, and sometimes we are frustrated. Too many patients the patient was not listening or following this carefully, and that become a barrier. And labor interest and curiosity are different. So this is the barrier, and we have to solve the barrier together. Why is effective communication important in the healthcare sectors? I think it's particularly important for medical doctors in family medicine. It is essential to have a smooth, systemic, and precise way of communication between doctor and the patient and the healthcare professions. Effective communication among healthcare professions is important because patient safety, team satisfaction and efficiency, reduce casualty, quality patient care, and organized medical record management. Effective communication between healthcare professional and patient is important because patients are having better satisfaction. Patients feel like a transparency. Patients are loyal, stick to the healthcare instruction, regular follow-up, and informed recommendations. So it's very important for better patient uh, communication with doctors. And here is the effects of a poor communication among healthcare professions. Sometimes healthcare professions do not have a good communication. Then you come with a poor patient care, increased casualty. Doctor nurses have poor communication, patients suffer. Poor organization, waste of time and money, less productivity, and also effect of poor communication between healthcare profession and patient. Incorrect recommendation. Patient got confused and got lost and trapped. Poor patient experience. They feel sad. They frustrated. They will not come follow up. Wrong diagnosis and prescription. That happened. Doctor do not listen to the patient carefully and irregular follow up. They will not come. They go somewhere else. They get lost and they got hurt. So these are all right up of the activity, effective communication skill. I will not go through it, but I believe you can practice this, and also between the colleague and between institutions. And so there was also Journal of Health Communication in Healthcare. It's essentially important, useful information for you to follow. And patient-centered integrated healthcare quality measures could improve health literacy, language access, and cultural competence. And this is published in a very important National Academy of Medicine. So communication and literacy are essentially integrated. And even European, they have attribute of health literate organization. And many things in healthcare, hospital, a manager can take it. So this is the last one I would like to share with you, make a summary. And also my recommendation is to practice health communication skills will benefit patient-doctor relationship. So we have to practice, improve it, create environment for better health communication, encourage patient for effective communication. Patient also have good incentive, stimulate health literacy learning and sharing during the communication, making health literacy between the core of this health service. Continue enhancement of health communication, patient participation, and follow-up is also important. It will be go through one again in each of the interaction between doctor and the patient. And also we have to evaluate health communication systemic in the institution and also in the society, including in the family medicine network, which you are having. And this is the last one, and I find it's maybe useful. The quote from Mr. Ho Chi Minh. He said, love other human beings as you would love yourself. And I think that is the communication between us, between healthcare profession, between institution staff, and also with the patient. And I like to congratulations for you, a beautiful success conference, and wish I can hear from you later. Thank you.